Hi, Dr. Ray Drury with you, and today I want to talk to you a little bit about lower back pain. Do you realize that 99% of lower back pain actually comes from the neck? Crazy, right? How could you have lower back pain coming from the neck? Well, so if you're going out and you're working in the yard, you're doing some things, you're using that back in ways you're not normally used to, and understand your back's going to get a little sore, a little achy, but within a few days, at least a couple weeks, that's going to go away, right? But you know that chronic low back pain, that oftentimes can even result in pain going down the leg? That's what I'm talking about. So what happens is within your body, you have something that's called the righting reflex. The whole purpose of the righting reflex is to make sure the brain's right or level or balanced relative to your surroundings. So what happens is maybe years ago, you could have had a bone in the upper part of your neck that shifted a little bit one way or the other way or turned somehow that changed the position of your head. Your brain didn't like it. The righting reflex kicks in and says, hey, the brain's not balanced. We got to get the brain back towards level. And it starts this chain reaction through your body, forcing your body to compensate to level the head again. Let me give you an example. So for me, let's say that I had a fall. I had a sports injury, a car accident. Something took my first bone to the left that way. Now, that threw the head off balance. My brain saying, hey, we're not level, we got to get straight. It can't undo the one that got out of line because it gets stuck when it misaligns. So what does your body do? It compensates. How does it do that? Well, it might pull down one shoulder. It might pull up one hip. Ultimately, it's going to contort my body till the brain levels again. Okay? So what does that do? Well, it creates some imbalances in your skeletal system. So have you ever heard of somebody like bend over to pick up their toothbrush and, oh, bam, their back went out? Well, obviously it wasn't the weight of that toothbrush that threw the back off, right? I mean, it just took the right movement, the right direction, and it hit that weakness and bam, it got you, okay? So what we have found is 99% of the time when you have chronic recurring low back pain, it comes from a problem in the neck. Now you may be saying, well, I don't have any neck pain. Okay, well that's okay because the brain stem, the nerve system that controls the rest of the body that comes out through those top two bones doesn't have any pain perception. You could have had an injury 20 years ago that has healed. The muscles, ligaments maybe don't have any pain anymore, but the rest of the body's still not unwound from that injury because the bone's still out of line, forcing your body to compensate. So what we do at the Upper Cervical Spine Center is we can evaluate you to see if you have a problem in your neck that could be causing the problem in your back. If you do, we're going to show you that. And we're also going to show you what we need to do to try to correct that. Now, if you live in the Charlotte area, please give us a call at the number on your screen. We'll be happy to get you in and check your body out to see if you're long-term, if you're chronic back pain, sciatica, it might be coming from a problem in the neck. If you don't live in the Charlotte area, then do yourself a favor, find the closest upper cervical doctor to you, and find out if that might be the cause of your back pain. Get the problem fixed. If you get the cause taken care of, you won't have to continue to live with it. Wish you the best. Thanks for tuning in. Hope to see you soon.